So we're going to be talking about computer vision syndrome. And the reason you need to know about it as a neuro-ophthalmologist is it comes to us and it could sound like neuro-ophthalmology, but it's kind of very weakly neuro-ophthalmology. The way it comes to us is that patients have blurry vision and it's at near, and obviously the computer, the phone, and even just like conventional reading, it can cause it. They might have diplopia, binocular horizontal diplopia from convergence insufficiency exodeviation. So the eye is going to want to feel like it's drifting, or they cover one eye, it feels better, or cover the other eye. And they're going to have dry eye, which is going to lead to foreign body sensation and pain. So the combination of these ocular symptoms plus headache and neck strain, and you might be saying, how could neck strain do that? And that's because your head down position is not physiologic. So the physiologic position in primary gaze is looking straight ahead, and so these are going to be important considerations when we get to the countermeasures. But it's counterintuitive that they might say their neck is hurting them. So neck pain, headache, dry eye, foreign body sensation, binocular diplopia, blurry vision, but the key thing is at near with use of devices. And even though it's called computer vision syndrome, it can be your phone, or it can be Kindle, or it can be any of a number of devices that the people are using. So their acuity in their field and their pupil are all going to be normal. Their motility examination might show exodeviation, but only at near, and they might have good fusion if they're young, and they might have breakdown of that fusion and develop a decompensated 40 if they're old. A lot of people have dry eye, so that's not specific enough, but even though you're going to test the person for dry eye, and you're going to ask them about the headache and the neck pain, but usually it's all about the history. And the history is at near with use of these devices. Of course, we don't have a cure for this, but the countermeasures are 20, 20, 20. Every 20 minutes, look away for 20 seconds, 20 feet away. The reason you have to have the 20 feet away is to reduce the accommodation. You have to break the accommodation and look away. And it has to be 20 seconds so that you'll have time to rest. And it's every 20 minutes so you can reduce the burden from the computer vision syndrome. And therefore, you need to have a high index of suspicion for patients who have the computer vision syndrome. We're going to offer them the countermeasures. You're going to treat symptomatically the dry eye and headache. And for the neck pain, we have to have good posture, and we have to be setting the computer at eye level so that you're not looking down all the time. So we have no cure, but we do have countermeasures. You need to know that computer vision syndrome sometimes comes to neuro-ophthalmology, even though it's a disease of the modern era.